Hello and Assalamu alaikum. I hope all of you are fine. Okay, so today is our very first class. I would like to welcome all of you here in our first class. And firstly, I would like to introduce myself. My name is Dr. Fawad, as you all guys I think might know. I'm a resident of neurosurgery. Currently, I'm working in Lahore, Pakistan. I did my MRCS in 2023. I appeared in Part A in 2022, in probably in December of 2022, and then I completed my Part B, subsequently probably in I think 6 months of time. And I am graduate from the Royal College of Surgeons at Edinburgh. I recently also did my MRCAM, that is the membership of Royal College of Emergency Medicine as well. So I would be your tutor and mentor. I started this academy after I passed my MRCS in 2023, and since then we have been teaching. Me and my team, of course, we have been teaching the MRCS. Either it's A, either it's Part B, and also we're dealing with a lot of other courses and schedules as well. Which, of course, as now you are all in my session, and we will be talking about all other things as well. That how you need to take your career along, how you need to take your researches, your orders, and other things along to excel in your surgical field as well, and also to gain a good benefit when it comes to your CV and in getting some good jobs out there wherever you're working right now. So I really welcome you all, and I hope we are all going to have some wonderful time. So today we are going to talk about a very basic thing, and that is like how to prepare for MRCS Part A. To be honest, I think this is the 50% of whatever you need to know about MRCS. Because I think if you know how to study and from where to study, this is your 50% preparation is done, because you're not going to waste time on the things that doesn't really matters. I used to say to my friends, like, in any exam, you need to know what to study, and more importantly, you need to know what not to study. Because if you need to know what not to study, you won't waste your time, and all of your time will be spent on the things that really matters. That this session is going to be all exam focused, because I want to train all of you to pass this exam with good marks. Not just pass this exam, I want all of you to pass this exam with good marks, inshallah. So the first slide that we are going to talk is, of course, the goal, and our goal is to effectively pass and prepare for MRCS Part A 2026 exam. What are our key focus areas? I will be talking about the study material and resources that are actually required to pass this exam, some lecture content and self-study strategy as well. I'll tell you what we will be talking when we will be like doing our lectures, and also I'll be talking about how you are going to do your self-study as well. And lastly, I'll tell you how you need to do your question banks that you have. Of course, I'm going to tell you what kind of question banks we're going to have, and how you need to prepare and take these question banks along. Come on to the slide number 2. This is regarding the study material and resources. To be honest, if you are going to explore different groups and different things online, you're going to find a lot of different things. You've got EMRCs, you've got past tests. There are a lot of people who are going to say that, sir, what about this book? What about this book? But I just want to tell you one thing, that you need to do whatever I am saying to you, and inshallah, I'm sure you're going to have very good results. So the first thing is the primary source. Our primary source would be EMRCS. That is a question bank and actually recommended by the Royal College of Surgeons. I am not saying that whatever you're going to study in EMRCS is going to come straight away into your paper. But whatever you're going to study will make sense. It will make your concepts very good. It will make your basics that will help you to solve your questions in the paper. And this is, I think, what really matters. So our basic knowledge, core knowledge is EMRCS, and we're going to study and we're going to make slide from that EMRCS as well, to make it easy for you. And then we got some supplementary material, and that is your recalls for the later phase of preparation. Right now, what you need to do is you need to get your EMRCS, and we will be studying that, inshallah. So your recalls is for the later phase. Then it comes to your anatomy, physiology, and pathology material provided separately. I'll give you some offline PDFs. So what you need to do is you need to get some separate time off, maybe 1 to 2 hours a day for your anatomy, and 1 to 2 hours a day for your pathology and physiology. You will be doing one of these, either it's physiology or pathology, because I think 1 hour is enough for one of these. So you'll be just reading it out. I'm not saying just remember everything in your first time. You just need to go through the syllabus for once, and once you do it, and I'll be letting you know like how you need to proceed it further lately. So if we talk about the lecture content, like what are we going to talk in our lectures that we're going to have, the sessions that we're going to have. Number one, it's a systemic surgery. If any one of you has already bought your EMRCS, you might have an idea, like you have got around 2300 questions, around approximately there are 2300 questions, and all the questions are with explanations. So we are going to talk about all of these units that are in your systemic surgery. And if you exclude the systemic surgery, the remaining things would be your anatomy, your physiology, and your pathology. Okay, so excluding your anatomy, physiology, and pathology, we're going to have lectures, proper lectures on that. And if I talk about anatomy, because a lot of people actually have problem in anatomy, and they're like, sir, we are unable to give it a lot of time because anatomy is pretty dry. If you study it maybe for 10-15 minutes, it feels like you're studying for a whole day. So this is something that is really problematic, and for this reason we have arranged a separate tutor for you guys, and inshallah she will be leading you guys in your anatomy sessions as well. She'll be conducting sessions in your weekends, and that will be like maybe 1 to 2 hours session, and that will help you to do your anatomy questions, and it will take you long as well. So remaining physiology and pathology, of course, you need to do it, and I'll be there for you, and I'll be helping you and telling you how to do it. So your anatomy, physiology, and pathology are basically your self study with guidance, and I'll be letting you know how to do it. I will provide you material and will tell you how to do it. If I talk about anatomy, and if you see that anatomy in your EMRs, that is mixed, your questions are mixed. So I'll be providing you the separate PDF. Like, the mixed means your first question is from head and neck, second question is from lower limb, third question is from upper limb. So it's all mixed, and it doesn't make sense. It was very problematic for me. I remember when I started preparing for that. So for your convenience, we have made separate PDFs. Separate PDF mean we have separated all the questions from upper limb, all the questions from the lower limb with explanation. So I can provide you those PDF, and what you need to do is you need to study all of them separate. Like, okay, so this week I'm going to do all the upper limb, this week I'm going to do all the lower limb, and vice versa. And you will be doing it, and it will make things. I think things will make sense by this way. So if we talk about the slide number 4, this is approach to anatomy. I think I already told you about it. So we got offline EMRCS question bank. That is, like, we got some separate system-wise PDF. I'm going to give you that. That is your head and neck, upper limb, lower limb, thorax, and everything. So in short, systemic learning should be there. You should be doing your upper limb separately. You should be doing your lower limb separately, because if you do that, it will help you to retain things. If you see that PDF, your similar explanation is repeated maybe 4 to 5 times in that same PDF. Don't worry about the number of pages in the PDF, because you're going to find 200-300 pages. But I'm telling you, if I'm going to make all these PDF as like one slide at a time, or one session at a time, so that is very easy for you, because it will maybe, I think it will reduce to around 100 pages. So don't worry about the number of that PDF, and you need not to worry about that. Okay, so if I talk about the next one, that is your online question bank, and that is your transition to the randomized question after offline preparation. There are a lot of people who ask me, sir, do we need to do only the offline one? I think offline is enough, because you will find that only offline PDF everywhere. So you like, is it important to buy that online PDF or online question bank as well? So my answer is yes. And the reason being, in the paper, you need to solve around 300 questions in a time span of 6 hours. So that, normally if you start doing MCQs, if you do maybe 10, 15, 20 MCQs, and after that 10, 15, 20 MCQs, you would be like, your brain would start fading out, and I think you would find it very difficult to concentrate lately. So this is something that is very important. You need to have that brainstorming activity every day. Every day you need to solve your questions, and if you do that, your brain will be exercised enough on the paper day that you would be able to do everything very well. And of course, solve 300 questions in the time span of 6 hours. That is very important. So the next one is your slide number 5, and that is regarding your physiology, pathology preparation. Study pathology and physiology daily. As I told you, for like maybe 1 hour or 2 hour is enough for that. So use provided reader notes. I'm going to give you some notes as well. They are just the notes. So whenever you do the notes, and if you solve online questions, things would be very easy for you. afterwards. And of course, you need to practice questions as well. There is a separate PDF as well that has the questions in there as well, and of course the explanations as well. So if you read that PDF as well, and you do your online question bank, online EMRCS question bank, things would be very easy for you. Of course, I'm going to provide you this material as well. If we talk about the slide number 6, this is your daily routine. As I already told you, number one, you need to do your anatomy study 1 to 2 hours daily. I'm telling you, if you do it 1 to 2 hours daily, things would be very easy for you. If you would be like, okay, so lastly, I'm going to study anatomy for 1 whole month or for 10 days. Anatomy is something like if you do it for 10, 15, 20 days, and then you take a 10, 15, 20 days break. And as you take a break and then you start it again, you would be like, I'm reading it for the first time. So my opinion is you don't need to leave it at any cost. You do it every day for 1 to 2 hours. So solve almost 50 questions, and I think, to be honest, 50 is a lot of them. So if you do even 10, 15 questions a day, that would be more than enough. Next is your pathology and physiology. So you dedicate 30 minutes every day to it, balance with anatomy practice questions, and lastly you're going to do your systemic surgery, and of course that is with your lecture content. So focus on the unit that is taught in the lecture. I'm going to teach every unit, every systemic surgery unit, and if you do that, if you listen to the lecture, your questions would be very easy. You will be doing your questions and you would be like, okay, so I know all of this, I think already. So it will be like a piece of cake, and very probably very easy for you. So solve related questions post lectures. As you listen to the lectures, you solve the questions lately and things will be easy for you. If we talk about the slide number 7, come on to the next slide. This is lectures plan on the follow-up. So we'll be starting from the abdomen unit. That would be the first unit because that is slightly tough, slightly conceptual. So this is what I always do. I start from the abdomen firstly. We'll be doing that. Your abdominal surgery would be the first unit we're going to have a lecture on. And after each lecture, you will be solving your questions from your online question bank, not the offline. Because when it comes to the systemic surgery, I will be teaching you properly. So afterwards, things would be easy for you. So you straight away jump to the online question bank. And as you do that, as you complete your unit, as we complete your any unit and you solve your questions, you will be letting me know your scores, because this is something very important. Your daily progress should be there. You should be telling me like, sir, I have solved this unit and I have got these scores. So these I am going to write it down in properly in my diary, in my notebook. So at the end of some session, I would be knowing that where each one of you is lacking, so we can properly focus on that as well. Next slide is regarding the final phase of preparation, and I think this is something we should be talking about maybe after 2 months, and that is your transition to the recalls. I am going to tell you when you need to start your recalls, okay? And that is the time where everyone need to start. Recently, in our previous session, there were a few students who started lately, and at the end of the day, they were really regretting it. They were like, "Sir, we couldn't do it very well. We just could give 1 to 2 reads of recalls, and we couldn't do it very well with concepts." And this really like pushed us back in the exam. So I'm going to tell you the date. Like, this is the date. Right now, you need to start your recalls and start in the same day. Don't delay it, okay? And next is the continuous feedback. You will be reviewing your mistake and improve your weakness area. And of course, I'm all available. We'll be talking. I would request everyone, if anyone has any question during lecture, after lecture, they can post in the group, not personally, because if you do it in the group, I check group every day whenever I get time. So it would be easy for me to answer that. I will also add few seniors, and even right now you have few seniors who have already passed their exam in the group, and they will be helping you with this as well, inshallah. So we will be reviewing your mistake, improve your weak areas, and we'll be talking every day about it, inshallah. Last slide 9 is your key tip for success. Number 1, it's consistency. To be honest, even if you're intelligent, you're very intelligent, you would be intelligent, I agree with that, but if you don't do your hard work and if you're not consistent, I literally don't need you, because for me, all of you right now is my responsibility, and your exam is my responsibility. I feel it, and I'm going to be very hard on the people who are not going to listen to me. This is very loud and clear to all of you, okay? So consistency is the key. Number 2, practice. Solve as many questions as possible. As I will be telling you, like right now, you need to do this. Don't jump onto the units that we didn't do. Okay, you will find them very difficult, because if you do that, you will be like, sir, my scores are hardly around 35-40%. You will be very worried. So don't do that. until I teach you or tell you how to do it. Next is your feedback. Your feedback is very important. After every 10th day, you need to give me, tell me an inbox, send me an inbox with your detail. Like, I have read this. I'm lagging in this. I'm improving in this, and this is what I'm doing. And also, you can give your suggestions regarding your session as well. Like, sir, I'm finding this difficult. I'm finding this easy. So I would be grateful if we can add this, so we can at least talk about it. Okay, so you need to give your feedbacks. And lastly, your balance is very important. So combine lecture content with independent study. A lot of people say, like, sir, it's very difficult for me to do all these lectures and blah blah and then do anatomy as well. Don't say this. Even if you got hospital to work, I am doing hospital job. I appeared in 10 postgraduate exams. मैंने 10 exams दिए हैं. I have already passed 10 postgraduate exams, and I never left my job for once, even for a day. Not even for a day before exam. So the just at the exam day, if the exam is at the morning, so I need to take a morning off, and right at night I would be back at my duty. So this is what I need to do. Don't want to listen any excuse that I have kids to manage, I have family to manage. I understand that, but you need to be very consistent and you need to balance everything. This is how you pass your exam. You're not kids that you need to leave everything and sit like, okay, so I have my exam, I have full 1 month, I'm doing absolutely nothing, I want to pass. Don't do that. You need to do all the other things as well, do all your duties as well. Don't leave your jobs. And if you don't have job, of course it's a blessing in disguise. If you don't have a job, so you can give extra time, just do that, but don't leave your basic course. Okay, so combine lectures content with your independent study as well. Last slide is, of course, thank you. Thanks to everyone, all of you, and I'm sure you're going to have a good time. And one thing that I tell all my students, and that is, there are two things that are very important in your MRCS route. And that is, number one, you need to have a very good belief, strong faith in your God, that if Allah Almighty has selected you for this path, of course, you're going to have guts and you're going to have all the material, all the assurances that you're going to pass this exam, inshallah. Because there would be some motive that Allah has guided you, tempted you towards this exam and towards this session, number one. And number two, you got to be self-confident. I want to see all of you very confident, very good speakers, and very confidently solving all the questions, because all of you are now a kind of my responsibility, a part of my session. So I want to see all of you very confident in that. And you should have the strong faith in your heart that I am going to do it no matter what, inshallah, inshallah. So best wishes, everyone. I hope all of you are going to have a very good time with me and with my team as well. Best wishes. God bless you all. Allah Hafiz. And if anybody who has got any question, they can post in the group. Of course, I would be happy to answer that, and in text or in the voice messages. Thank you.